Neil Gray, Cabinet Secretary for Health and Social Care, thank you so much for spending time with us today. And I wanted to ask about your reflections on 25 years of devolved health powers in the Scottish Parliament, and how you feel that has gone.
Well, I think as a child of devolution, I was part of the school child parade going down the Royal Mile in '99 at the reopening, reconvening of the Parliament, and I can see through my moving into teenage and adult years the shift that there has been in policy and enactment of reducing the harm that smoking causes. And I think the really defining moment for everybody has been what happened in 2006, the passage of the ban on smoking in public places and indoor public places. And I think that's really made such a huge difference. And I was a student at that time. I remember it well. Instead of going into a pub and smelling cigarette smoke, you would smell other things instead. And it was a complete shift in terms of what was normal behaviour. And I think that has moved to a willingness on the part of the public to accept the fact that there is going to be probably further restriction in terms of where it's acceptable for people to smoke, and to support greater services of smoking cessation that we're seeing in Scotland as well. But what has been really defining in terms of what devolution has allowed us to do is see the cross-party consensus develop around the need to take further action on controlling the harm that has been caused by smoking. It was an SNP MSP, Stuart Maxwell, that brought forward the bill. It was a Labour and Liberal administration that then took it on and delivered it. So we've really got a cross-party consensus that they were able to see in your event in Parliament a few months ago around the need for us to continue our work towards a tobacco-free generation by 2034. So I'm really positive about the impact that devolution has had in this policy area.
It has been a real strength of the Scottish Parliament, just that consensus, that working together for the good of Scotland's population.
Yeah, and we've still got more work to do, Sheila. I don't think our work is done, that's clear, and I'm sure we'll go into some of the areas that can build upon. We're still seeing 9,000 deaths in Scotland directly attributable to smoking, so we've still got work to do, but I think the declining smoking rates and is a good thing. We've still got a health inequalities issue here, where it's far more likely that someone will smoke in a deprived part of the country than in a less deprived area, and so thereby the risk of people suffering chronic ill health as a result in more deprived areas is higher. And I think that, along with the other practical reasons as to why we want to see that tobacco-free generation by 2034, is absolutely about making sure that we're addressing some of those health inequalities that are directly attributed to smoking.
Thank you. So, how important would you view the role of advocacy organisations like Ash Scotland in collaborating with the government to deliver some of those health improvements?
Absolutely fundamental. I mean, I think alongside the cross-party consensus that there is, I think having the expert organisations like Ash Scotland not just advocating, evangelising about the importance of this work is critically important, keeping us from complacency and making sure that we are adapting to the changing nature of the landscape that we're seeing in terms of respiratory conditions and those that cause them, because obviously we've been talking about smoking, but we've also got the new challenge of vaping, which I believe is a real issue for us, particularly with our younger generation, and making sure that we're not shifting from getting to a point of being tobacco free to then seeing a greater reliance or greater propensity of vapes. And I think there's work to be done both in a Four Nations basis and in a devolved space to ensure that we're tackling both. And the work that Ash has been central to over the decades, and particularly through devolution, has been absolutely fundamental. And I would attribute that, but I'm sure colleagues who have come before me would do so as well.
Thank you. So, Ash Scotland warmly welcomed the tobacco and vaping framework that this government has launched as part of our pathway to 2034. What would you see as some of the key actions from that framework?
So it's about making sure that we are responsive to the modern landscape and making sure that we continue to take action to promote smoking cessation and take it being about promoting a person-centred approach. And the vaping element is a challenging one, because we are seeing such a pervasive use within the younger generation that we need to make sure we're taking proportionate action, and doing so, I think that goes, yes, it's about education and marketing, but goes beyond that, and I think the framework will help there, as will the tobacco and vaping register, which is about making sure that we have a good, strong collaboration on a new deal for business basis with our retailers to make sure they understand their responsibilities, and we are supporting them in the work that they're doing. But I think what's also interesting is the success of our work in collaboration with ASH and on a cross-party basis means that I understand that some of the young people that were involved in testing some of this had to be educated on the brands that were available of tobacco brands, because of the effectiveness of the restrictions in marketing that we've seen over a number of years. So I think there is lessons to learn in terms of where we have come from. The framework helps to build upon that, and there is more that we can do with the likes of the registry and the reincarnation of the tobacco and vaping bill on a UK-wide basis. So there's a lot in there that we can build upon and work to, so that we can make sure that we arrive at the tobacco-free generation in 2034, but also we restrict the ability of vaping to take hold as well.
And I suppose new products that are bubbling up, nicotine pouches, we've seen uptake with young people.
Yeah, and it's a real worry, because the health impacts are only just beginning to be understood from an empirical perspective, and certainly I don't believe that they have been understood amongst our younger generation in the same way as we've been successful around smoking, and making sure that people understand the very real health risks that are associated with smoking. We need to make sure we get to that point with vaping and with pouches and all the various products that are coming. I think we just need to make sure that we're proportionate in that approach, and making sure that what we do takes people with us, because that's where I think we've had the greatest success around the ban of smoking in public places. I think that has now been embraced, and we need to make sure that we follow a similar journey.
Absolutely, and I think you do have the public with you in restricting those products that are particularly aimed at children and young people. We're certainly hearing a lot of concerns from parents, teachers.
It's understandable, because they're clearly directly marketed at children and young people. It's absolutely clear and demonstrable in what you're seeing on the shelves, and we can see from the uptake levels, where the uptake is, and it's in amongst the younger generation predominantly, and so that's why we need to make sure that we're helping and supporting parents and schools, so that there is that understanding of providing that education and support to our children and young people to make positive choices, but also that we're taking the policy approach, the legislative approach, to ensure that the balance is there between restriction and education and personal choice, and that's a balance we need to get right.
So we were really delighted that the Scottish Government took a lead with implementing a ban on disposable e-cigarettes because of health and youth uptake reasons, and also because of the huge environmental harms that these products do. And I'm pleased to see that progressing, and the Scottish Government continuing to show leadership in that. Are there other things that Scotland can do with devolved health powers? For example, we still have outstanding regulations from the 2016 Act on the promotion and advertising of e-cigarettes, which are complementary to what we hear is going to be proposed at UK level. Is there scope to make a four nations approach and a devolved health approach work well together?
Well, we have to make it work well together, and that's why I've been so pleased that, to be fair, the last UK government engaged well in terms of their iteration of the tobacco and vaping bill, and we've started on the right space in terms of the new Labour government's approach, and approaching it from a basis of on a four nations basis. And I'm encouraged the fact that it's in the King's Speech, so it's something that they are seeing as being a continued priority. They also appear to be wanting to go further on some of the elements within the bill, and so that it means that we obviously have to adapt our considerations as well about how we take forward some of the elements within the framework and the regulations that we have available to us. Obviously, we have to be proportionate, we have to remain lawful in that sense, but also that our interaction with what comes forward on a four nations basis means that it is complementary, it is going to be workable and is evidenced as being the right things to do. So yes, we'll consider, obviously I would wish us to come forward with further regulations, but the interactions with the bill at Westminster means obviously we've had to take stock on that. But we'll continue to consider how we can use the powers that are available to us and make sure that we take proportionate steps that are going to see further restriction in the use of vaping and e-cigarettes where possible, and ultimately, which is all of our goal, to see that smoke-free generation 2034.
And I suppose just a comment from me that it's been good to see Scotland take a preventive approach, take a precautionary approach when there are so many unknowns about some of these products.
Yeah, so this goes back to the heart of our vision for our health and social care services in Scotland that I've got a responsibility for, which is about meeting the demand that is there, but also preventing the escalation in demand. So the work that we've been doing in government over the last 17 years on smoking, but other policy areas on preventing ill health is critically important here, and that's why again I reiterate the importance of the interaction that we have with Ask Scotland and other expert organisations in terms of making sure that we're responding to the shifting landscape that there is. I don't think when we're talking about banning smoking in public places in 2006 we would have been able to consider what was to come in terms of e-cigarettes or vaping or any of these products that would become so prevalent and such a public health issue. And so that's why we need to continue to interact on that basis, but also with our colleagues at a UK level to make sure that where there is a UK-wide response that we are collaborating with that.
So the World Health Organization brokered the first ever public health treaty, the Framework Convention on Tobacco Control, and one of the articles in that makes clear that the aims of the tobacco industry are fundamentally and irreconcilably opposed to the aims of public health. How important is it for us to act in accordance with that treaty and keep the industry from influencing public health policy?
Well, in the Scottish Government we always will, and I've got responsibility to make sure that is shared across government, and we do that. I don't believe that the industry has any role to play in the formation of public policy in this sense, and the World Health Organization have been clear on that. And I think we've got a record to demonstrate that has played out in terms of the way that we have developed our public policy in Scotland. I think we've got a responsibility though to make sure that what I point back to around our interaction with retailers and those organisations, that New Deal for Business interaction is still strong, to make sure that we have a clear understanding amongst our retailers of their responsibilities, but also what support is available from us to ensure that they're making the right choices. And I think the opportunity that's before us with the advent of the registry will help to enhance that. But in terms of Article 5, we're absolutely clear that is at the heart of our policy agenda here in terms of tackling smoking and vaping in Scotland.
Thank you. And if there's someone out there who's a smoker but is keen to quit, what would you say to encourage them?
Keep trying. Absolutely keep trying. Whether it's your first time attempting to give up or your 50th, you have support out there. There are smoking cessation services and various help to quit programmes available. There are plenty of peer support groups there as well. And when we consider the fact that we are still facing the prospect of 9,000 smoking-related deaths in Scotland, it is a very important choice that's been made there. I've never smoked myself, so I will never judge somebody on the very difficult process that it is to be able to give up that addiction. But I've got family members who have been through that process. I understand how difficult it is. But their success was down to a determination to change their lives, but also because of the support that was around them. So seek that support and do all you can to give it up.
Thank you very much, Neil Gray, for taking the time to meet with us today.
My pleasure. Thank you.